Preparations in the health services are evident in the latest medical equipment, infrastructure and hygiene in hospitals. Some foreigners who already live in Rwanda are appreciative of the quality of health services they receive.
Overall, I would say that it is really very, very good. Very good, and then I would even appreciate people to come to visit Rwanda to see the medical facilities which may help Rwanda to enrich the facilities of medical treatment in Rwanda.
The medical facilities have improved quite a bit now, and also the infrastructure is great right now. But I think they need a bit more of development in customer service, so that delays and how the procedure goes on, a bit more organized.
Some health officials and health professionals say beyond preparations for CHOGM meeting, they have been eager to improve service delivery for the sake of their clients.
A key hospital in that journey, but to reach that goal, I think there are mainly three components. There should be adequate infrastructure, equipment, but also competent human resource. So we are trying to tackle on these three components with the support of the government. But as we are now, we are receiving patients from different countries, mostly neighboring countries. As far as now, I think there is a journey. There is a long journey, but I think the services that we provide, we are trying to improve them, and we hope that in the near future we'll get more patients, not only from neighboring countries, but mostly from other parts of African countries.
Professor Emmanuel Rudachemwa, a medical specialist and university lecturer, says that the medical sector in Rwanda is so advanced and that no Rwandan or foreigner has to worry about receiving treatment in a hospital.
Most
people don't actually come in sick. You find that more than 80% are not severe cases. For people who have chronic diseases, there is no need to worry because we have a hospital that is equipped to help people, even cases where one needs kidney cleansing services. There are a high-level diagnostics of these devices. For instance, someone who has had an incident like a stroke often feels like a mental accident or a heart attack, and the heart has a problem. We have a hospital well equipped to provide quality care in the event of such a problem. So there is big progress.
Emergency response is one of the main ways that can help in the emergency-related scenarios. The coordinator of the emergency response services, known as SAMO at the RBC National Center for Health, says there are 330 ambulances nationwide, but the CHOGM gathering has been given 18 ambulances to serve exclusively. We have also selected ambulances for the event itself, and we have been examining closely their state to see whether we need to improve them or not. We will be using 18 ambulances wherever there is a large crowd, like at the airport and where people will be meeting and sleeping. Our services will be available. Our ambulances are equipped with adequate medical care, and the most qualified physicians will be in those ambulances. We are also looking into increasing the number of operators for the emergency helplines because we anticipate high traffic during that time. Health officials say when CHOGM participants travel to different parts of the country to visit nature attractions such as parks, health services will be in reach. Hotel and tourism staff have also been trained to provide first aid when necessary.